anesthetist from Amstelland Ziekenhuis. She will be discussing, for the benefit of our listeners, this let's discuss area of medicine and its administration and risk. So, for you to know her a little bit, this is a bit of her bio. 1987 to 1993, she studied medicine at the Free University of Berlin, Germany. And then from 1993 to 1997, she became specialist in anesthesiology and emergency. She studied anesthesiology and emergency medicine. So 1993 to 1995, she worked in the Department of Anesthesiology in intensive care in Central Clinical Brandenburg in Germany. And then 1996 to 2001, she was in the Department of Anesthesiology and Intensive Care in Amstelveen, Berlin. That means Ziekenhaus, hospital in Berlin. So in 1993 to 2002, she worked as an emergency doctor of the trauma helicopter in Brandenburg. And then 2000 to 2001, specialized in patients with burns and specialist in intensive care. So 2003 till now, she has been working in Ziekenhaus Amstelland. So, well, listeners, you can agree with me that our guest really is an expert in this field and has had a long experience and is very, very competent to discuss this issue. I mean, no other person can handle this topic better than Dr. Gehlich, who have been very active in the field for at least 24 years. We are very privileged to have her today in the studio. Please call us on the studio line once again on 020-737-1619, or you want to call us off air, you can call 0684-606-550, Voice of Niger. Well, Dr. Beate Gehlich, welcome to Radio Voice of Niger.
Welcome, Mr. Tolkeno, and also warm welcome to all the listeners. I hope it's an interesting point that we can make today to make patients less anxious about anesthesia, and hopefully they will come as patients to see me.
You know, when I was operated on phone, and then you came up with this anesthesia you gave me at the West.
Yes.
You know,
yes,
I was trembling. Did you see how I was a little bit scared?
Yes, I know.
But you made me to relax.
That's what most patients are, because luckily for most of the patients, they are undergoing anesthesia not very often.
Yeah.
It's only once or twice that they have to undergo an operation.
Yes.
And if it's a bigger operation then, where two different anesthesiologists may work on the patient, or where different techniques are necessary,
yeah,
then it's always a bit scary for the patient. That's normal. So, but part of my job is to make patients lose their fear.
So, doctor, can you please tell us, why did you specialize in this area? What is your passion?
There was a kind of coincidence. Anesthesiology was, when I studied medicine, not a very big topic.
Yeah.
During the study. And I thought, well, it is evident to know things about anesthesiology, and it's also evident to know how to resuscitate patients. That is part of the anesthesiology.
Yeah.
And to know how to deal with really, really sick patients,
yes,
after car accidents, after other accidents, with severe illnesses. So that was the reason why I thought, okay, I have to stay a time in anesthesiology and intensive care.
Okay.
But well, after having started with this specialization, I liked it so much that I'm still in it. So
you like it so much to put people to sleep.
I like it so much.
And then they wake up again.
No, it's more that I really like to make it possible for patients to undergo surgery and all kinds of procedures.
Yeah.
Without or with very less pain.
Okay.
So that's my point. So I want to make it possible that patients can be cured with no pain.
Okay. Now, who is an anesthesiologist? Describe it just with one word or two. So how can we describe your job?
Well, my job is to care for patients.
In the context of a layman's view, how can you explain it? Because we are calling this big name anesthesiologist or anesthesiologist or anesthesia. Tell us in a very simple word, what is it? What is your job?
Well, my job is to care about patients before, during and shortly after operation, or during other diagnostic procedures that may be painful and that need anesthesia.
Anesthesia.
And it's not only that I let people sleep and I wake the people up and I say, okay, my job's over. It's also I see people before the operation to make it very short, safe for the patients. I see people afterwards to prevent them from post-operative pain.
Yes.
So it's more or less care about peri-operative phase in the hospital.
Well, to those of you who are outside there and you are listening to us, we have Dr. Gehlich. She is an anesthesiologist. She is an anesthesia is somebody who puts who deadens. They give you the injection to deaden the part of you before operation takes place, so that you don't feel any pain. So maybe it's a major operation or a minor operation. There are those specialist doctors who you see in the theater who put you, sometimes they will tell you to count 1 or 2 to know whether you are still alive before the main operation starts. So you can see how important this job is. Now, is there anything else that anesthesiologists do?
Yes, we take care about the patient's circulation. That means the blood flow during the operation. We take care about blood pressure. Blood pressure should not be too low. That's not good for the brain of the patient. We take care about blood loss, that patients will, if necessary, get fluid replacement or get blood replacement if they lose blood during an operation. And well, we also look on the depth of their sleep. So we really care about, are they really sleeping deep enough, or are they sleeping too deep? So we're really looking that everything stays stable during the operation.
So, doctor, would you please tell us, are there some mistakes that take place during that sleep?
Oh, if there are mistakes?
Yes. Can somebody sleep that way and then did they wake up anymore?
If you let me explain the other way around. If you ask patients that has had anesthesia 20, 30 years ago, they may be patients that have experienced some strange thing like, I heard everybody talking during I was operated, or even I felt something during my operation, so I was not really asleep. That was in former times when it was not possible to make the technique of total anesthesia individual for each patient. But nowadays, if you are an elderly patient, if you are a child, if you are, let's say, small, if you are very big, like 150 kilograms or so, we have to adjust the anesthesia to that weight and to your age. And because we do so, it's not very likely that you will not wake up, and it's also not likely that you are not sleeping deep enough. So it is a bit individual anesthesia what we give nowadays.
Okay, so can I be allowed to choose any type of anesthesia I want? Is that what you're trying to say? People choose the type they want. The one that can put them half asleep, or the one that can put them full sleep?
No, I'm just saying, in some cases that's also possible. But what I'm saying is a man that is 80 years old and 60 kilograms will not get the same amount of anesthetic medication than somebody that is 40 years and 150 kilograms. So anesthesia is individually adjusted for each patient, so that it can't happen that somebody will wake up during the operation. And so that it also can't happen that somebody will not wake up after the operation. So there are still cases that people are not waking up after having anesthesia. But that's then because it's an emergency operation. It's maybe because there are people that are really seriously ill before undergoing operations.
Okay.
Or people that have diseases that nobody knows before.
Okay.
That also happens. There are, let me give an example, somebody with an abnormal blood vessel in his brain.
Okay.
There are people with abnormalities in their brain.
Yeah.
And yeah, well, if there is a bleeding during an operation, that may cause coma. But nobody could see this before in those patients.
Yeah.
So it's something, nobody knows.
Do you think this sort of thing can take place more in the underdeveloped countries than the Western world? Where to somebody
in some countries I think so, because there are reasons that those countries can't be so strictly with their regulations before anesthesia, or the regulations before people are allowed to undergo anesthesia and operations. In those countries sometimes people come from far away to reach a hospital. The operations are sometimes much bigger than here, because people come later, in a later phase of their disease, to the hospital, because hospital is too far away.
Yeah.
Maybe because they have to work hard, maybe because operations are too expensive.
Yeah.
So sometimes the situation of the patient before he actually is in the hospital is worse than here in developed countries. So it can make anesthesia more dangerous for those patients. And also, people don't know so much about their actual health. Yeah. They're not going to a doctor regularly, I think. Yeah. So maybe there is also not the possibility to perform an ECG, that is to check the heart rhythm before the operation. Okay. Maybe there is no possibility to check the blood before the operation. Yeah. That is all things that influence the safety of anesthesia.
So it is always then very important that people check their health condition all the time.
Well, that's truly so, but it's also very important that people are checked before they undergo an operation.
Okay, that is apparently the reason why the anesthetist normally have pre-surgery discussions, appointments, because you had with me. Yes. Okay, so in that discussion you try to know
how healthy you are.
Yes, exactly.
Yes. So
tell us a little bit about that.
So what we normally do is, if the surgeon decides that somebody has to undergo an operation, first thing we do is we give a sort of questionnaire to the patient. That questionnaire is very it's full of questions about health, about daily routine, about weight, about medication, about diseases of the family, about everything. Yeah. And first, the patient has to fill in this questionnaire. Then he comes back to the hospital and he sees the anesthesiologist. Yeah. And then the anesthesiologist looks at the questionnaire and starts discussing points that are interesting, that may be potentially dangerous for the anesthetic. So if the anesthesiologist sees that the patients are using certain kind of medication, if the anesthesiologist sees that the patient has problems with her or his heart, or with her lungs, or with I don't know, is not able to eat properly. Those things. Then we have to see what we have to do with the patient before he actually can undergo the operation.
But you know, Dr. Gehlich, in the third world country, I really don't think that they take all of these things into procedure, like making first appointment, second appointment with the patient, and then discussing all of this long time, all of this long list that you gave, your hospital gave to me when I had operation. Because you know why I'm very curious about this, or why I have been doing everything to bring you to this radio program, is that I believe many people may have had some difficult times. Like my family had a difficult time with our first daughter, who the husband rushed her to the hospital because we heard that she had fibroid and it was troubling her, and then the husband rushed her to the next the hospital. This was a private hospital, and then the next thing we heard was that she could not wake up during the operation. That's how we lost our first daughter. Wow. Till today, my father and we are still grieving about her because she was just about 53 or 57 years old. Then she just passed away this way.
It is.
And unfortunately, when we pressed that we needed to know this hospital and we needed to discuss with this doctor, the husband refused till date. We don't even know the hospital where our senior sister died. Well, you see? So when I was about to have operation, the fear came. My whole family was almost afraid, because the first daughter died through that procedure. So I believe if the doctor had taken time to ask all of these questions to this woman, she wouldn't have died in the theater or this, because, I mean, fibroid, I don't know how fibroid can kill somebody.
Well, it's always a difficult thing to judge about cases that happen elsewhere. And where you don't know the two sides and where you don't know much about, but there is surely a difference, or can be a difference, between emergency operations and planned operations.
Okay.
Planned operations is any operation that is planned for a fixed date. So the surgeon makes an appointment with you, and he says, okay, you will be operated on the 15th of September, for example.
Yes.
That's also how your own operation went, I think.
Yeah.
And if something happened to a patient, that, for example, a car accident, and the patient is unconscious, and he has to undergo surgery with the pre-existing unconsciousness. So in hospital there may be no family, maybe no relatives, maybe no passport from the patient. So then it's more dangerous, because nobody knows anything about such an emergency case. We just see a patient, then we see, okay, it's a male patient, he may be 80 kilograms, so, and then we have to go and give him anesthesia. But maybe he has serious condition that we're not aware of, because nobody is able to talk to the patient before. And maybe he has disease of his heart, of his lungs, that nobody knows. But there is no time then in such situation to wait till we have all the information, because then the operation would probably be too late for the patient. So it's surely a difference between an emergency case and a planned operation. But what we normally see are planned operations.
Well, listeners out there, in case you are just tuning in right now, we are transmitting on 105.2 MHz ether and 103.8 cable. This is your popular radio station, Radio Voice of Niger. Today we are discussing on how safe is anesthesia, and we have as our guest Dr. Gehlich, who is an anesthesiologist from Amstelland Ziekenhuis. All right. So, Dr. Gehlich, how safe is anesthesia of this modern time?
I think nowadays anesthesia it's really a safe procedure. We try to evaluate patients before anesthesia, before operations, so that we know everything that's important for us. And we also try to give the patients a choice in the technique of anesthesia as far as possible. There are some operations, I will give an example, an operation on your leg or on your feet. There you can choose between partial anesthesia, where you stay awake during anesthesia, or you can choose for total anesthesia,
Okay.
where you are in a sort of artificial sleep
Yeah.
in the time of the operation.
Okay.
As long as somebody has no medical reason to choose for one or the other technique,
Yeah.
we will let the patient do the decision what is more comfortable for the patient, and if we think both techniques are safe
Yeah.
for the patient, it's with what does the patient feel, what's more comfortable. One of our aims is really to make patients comfortable and to let them feel that they have the right to decide about their own body.
Okay. Which is all right. Which is very, very okay. Okay. So what can the patient do to make anesthesia safe?
Sorry,
What can the patient do to make anesthesia
yes.
safe?
Well, in first place, it's really important that the patient tells the truth. And that's
about their health condition.
About the health condition, and that's not already always easy for everybody. One of two of the questions, but for example, in the questionnaire is how many cigarettes are you smoking per day?
Okay, that's for those who smoke.
Some patients are not daring to say the truth about that. So some patients say, well, I don't smoke, but they really smoke 30 per day or 40, so that's really different.
Okay.
Or some other people are afraid to give the actual body weight. So if we ask for the body weight, some patients will tell us, okay, I'm just 60 kilograms, but he or she is 90 kilograms. So that really makes a difference. And that's because, well, the first thing the patient can do is be honest with us, tell the truth.
Okay.
And
but how about if they do not have idea of how much they weigh?
Well,
you should have those things.
We have a scale in the room next to me where it is, so that's not a problem.